This hearing is about Medicare finances, both how to strengthen the current system and how to pay for expanded coverage to include vision, dental, and hearing. The short version is this: the Medicare system is hemorrhaging money on scams and frauds. It is critical that we stop the flow, and if we do, the system will have more than enough money to operate at its current level and increase coverage. Where do we begin? Well, how about with giant drug manufacturers? In 2019, total Medicare spending on prescription drugs was $220 billion. Since Medicare is a very high-volume buyer, you would think that the Medicare program would be getting a great deal on pricing, but you would be wrong. Because Medicare cannot negotiate prices, drug companies are able to rake in billions in profits. Now, that's bad enough, but the drug companies have more ways to juice their profits. They use anti-competitive tactics like pay for delay, product hopping, and patent thickening, all while antitrust regulators turn a blind eye. It's enough to gag a maggot. There is so much we could do to improve Medicare finances. For example, we could save Medicare as much as $130 billion over 10 years just by strengthening enforcement of our antitrust laws and ending just one type of the industry ripoffs. Or consider another option. We could rein in greedy private insurers that take advantage of the Medicare Advantage program. Now, Medicare Advantage was a backdoor effort to privatize the Medicare program. It was built on vague promises of cost savings, but instead, it has cost Medicare almost $150 billion extra over the past 12 years because greedy private insurers are gaming the program's rules, including its risk adjustment process, its benchmark policy, and its quality bonus program, all to squeeze more money out of Medicare and to drive up the costs for taxpayers. Medicare could save nearly $800 billion over 10 years just by ending these scams. Together, just those few changes alone would save Medicare over $900 billion over 10 years. And just to put that in perspective, the estimated shortfall in the Hospital Insurance Trust Fund is $517 billion between 2026 and 2031. And the cost of extending Medicare coverage to include dental, vision, and hearing to the program is just under $360 billion. In other words, we don't need to cut Medicare benefits. We need to cut out the scams that are bringing Medicare down. The number of corporate vultures hoping to feed on Medicare continues to grow. Even today, in the Biden administration, CMS has invited the same insurers that are already scamming Medicare and dozens of new investor-owned organizations to cover traditional Medicare beneficiaries through a new privatized direct contracting model that lets them pocket, get this, as much as 40% in profits. This invites fiscal disaster, and I hope this administration will reverse this decision. Yes, we need to make changes to Medicare, but not the cuts and privatization that my Republican colleagues have sought in past efforts to so-called reform Medicare. No, instead of undermining the system and the benefits that we deliver, we need to crack down on greedy drug manufacturers, on private insurers, and on private equity firms. We need drug price negotiation, and we need better oversight of the Medicare Advantage program so that for every dollar spent, a Medicare beneficiary actually gets a dollar's worth of value. And with more than $900 billion that we could save, we need to expand Medicare coverage to include dental, vision, and hearing benefits for all of our seniors and people with disabilities who are part of the program. That is how we build a healthier America. Now, I look forward today to discussing these issues. I appreciate all of our witnesses who are joining us, and I look forward to hearing about their experiences and their insights.